So with that, I will turn it over to Claire Carmody with New Mexico CAL are the abbreviations, which is the New Mexico Crisis and Action Line, to talk about both the crisis line, the Warmline, and 988. So take it away, Claire.
Thank you, Greg. Hi, everyone. It's so nice to see so many people. Thank you all for being here. I'm going to go ahead and share my screen. Do you all see what looks like a PowerPoint? Okay, cool. So I'm going to just introduce myself a little bit, go over kind of what I'll be covering, and then kind of pass along to the 911 folks. So my name's Claire. I live in Albuquerque. I've just a little bit about me. I've worked for NMCAL for about 4 years. My first 2 years, I was a call taker. And then for almost the last 2 years, a little less than 2 years, I've been one of the supervisors, the clinical supervisors. I have here with me Nanette, who's a supervisor on our Warmline, Latanya, who's our Warmline manager, and then additionally Brenda, who's our director of clinical services. So in the presentation, I'm going to just talk a little bit about kind of our history at NMCAL, what you can expect when you call, when it's appropriate to call us, and then we're going to talk a little bit about some of the other services that we offer. And like Craig said, we'll be here at the end for questions. So in terms of our history, so we've actually been in the state for quite some time, about 12 years now. So NMCAL was the first statewide and fully state-funded crisis line in the country, which really made the 988 rollout very successful for us because we already had the infrastructure for taking calls. We already had staff trained, supervisors trained. And so really we were able to manage the calls pretty easily just because we already had all of those things in place. Around the time that we added or 988 rolled out, which was about 2 years ago, we also expanded our services to include chats and texts. So you can click a link on the website to chat with us online, and then also people can text 988 to get connected to one of our counselors. And then, so talking a little bit about when folks call us. So we really take a pretty wide range of calls. I put here on this slide some of the signs and symptoms of a crisis. So it's good to look over those and be aware of those and know to reach out when you or someone you love are struggling with any of these. But I also just wanted to note that, a crisis looks pretty different for everybody. What it feels like and what it can look like can be really different. We don't have any requirements or thresholds to call. So we really trust that people know themselves, know their loved ones, and know when they need support, when they're needing to reach out. And so, yeah, it can look really different for everyone. I know when I was a call taker, I remember people calling in and would say, I didn't know if I could call because, I don't actually think I'm going to kill myself, or I didn't know if it was bad enough yet to be a crisis. So I think it's really important that we just want people to reach out anytime that they're feeling like they need that support. Hopefully that would prevent it from getting to a place where it's like an acute mental health crisis. But certainly we have no criteria of that has to be met. Our goal when taking calls is we're going to do some assessing, create an intervention plan, and then one of the things that it's really, really important for us to do in our role is make sure that we're referring folks back to those local resources or the ongoing supports and services that they have or they might need. When you do call, what it sort of looks like is our counselor will introduce themselves. They'll start by gathering some demographic information. Anyone can decline the demographic information and remain anonymous. That's, totally fine. We do ask the demographic information because it can be really helpful in knowing what services they might qualify for, what's, did I freeze? Am I back?
Yes.
Okay. But it can help in our referral process if we know, some of those demographic things. After gathering the demographics, then we would kind of explore with the caller or the visitor what's going on for them, kind of what brought them to reaching out. While we're doing that, we're also going to be completing our assessments. And from there, we'll work together with the person to identify the appropriate interventions that are available, create a plan for the next step. Often those plans that we're creating with folks is, to get them through the rest of the night, to get them through their day. So they're pretty short term. And then we're going to have those referral pieces helping kind of on the back end of that plan to further support them. Yeah. I also wanted to just put up here some of our numbers so you can all see kind of what it looks like. On the chart, the numbers are separated. The New Mexico Crisis and Access line, which is our traditional 10-digit phone number, and then the 988 line. The reason they're separated is just because they route differently to us. So anybody who calls 988 is going to get routed through the national system to us. But essentially, once we pick up that phone call, we're going to manage both calls exactly the same, with the same staff, the same resources. So 988 certainly has helped a lot, and it just in the sense that it's really easy for people to remember and call when they need support. But it's, we're managing things on our end very similarly to how we have. I also did want to mention, so after the rollout of 988 about 2 years ago, our call volume has more than doubled. So certainly, I think between the number being easier to memorize and how much marketing and the public awareness campaigns that took place, it really did increase our call volume. And even though that we've had such an increase in call volume, our average speed of answer is still at 18 seconds, which is about twice as fast as the national average. And New Mexico, right now, we are 5th in the nation for the use of 988. So that is how many calls we're getting compared to the population. So we're 5th there, which is great. And I really think a lot of that is due to the fact that we invested really early in mental health and crisis support. We've been, we've worked with a lot of stakeholders across the state, had a lot of support all of these years. I know that like the New Mexico Behavioral Health Services Division and CYFD have been really great advocates for us and have always invested in our services. So that's kind of led to a place where we can support something like a 988 rollout. I also did want to mention here that the way the phone system for 988 works is that you're actually routed by your area code. So it's not like when you call 911, you're routed by your actual location. For us, you're routed by the area code of your phone number. And the reason I mention that is because we've found that sometimes people, if they're trying to transfer from like a 1-800 number, like another 1-800 number, it can get funky. And the other thing is if you live in New Mexico and you just don't happen to have a 505 or 575 area code, you can reach us just calling our traditional 10-digit phone number. But it's also, any 988 center is going to support a caller regardless if they live in that state or not. And we have our own, policies kind of in the background of transferring back and forth to each other. So you'll definitely get to the right spot, even if you call 988 and you don't have the New Mexico area code, but just in case that's helpful for you all. Uh-oh, the picture didn't come up. I also wanted to talk a little bit about the other services we offer. So in New Mexico, we actually have something really unique called NM Connect. And what it is a smartphone app that the state, paid for. So anyone in the state of New Mexico can access it for free. And it's like it's self-paced. So you can use it, anytime, day or night, which we found can be really helpful, especially like the middle of the night when not as many resources are available to folks. And so basically it has different mental health materials, some things around self-help and wellness, some things around coping skills. So it's just kind of giving a basic education around some mental health topics, suggesting some things people can try. And it also has a lot of resources that are there in the app. So you can kind of look to see what resources might be available to you. And it also has some of the information from our from the New Mexico 5 Actions, which is a self-guided like recovery support program. So that's all in there as well. So it's a really good kind of hub for mental health. There's some places where it will like encourage folks to call or remind folks they can call if they want to. So that, we definitely invite all of you to download it if you think it might be helpful, and then, make sure to tell people because it's a really great free resource. Oh, there it is. That's my picture. I'm going to pass it on now to Nanette, who's going to talk a little bit about the peer-to-peer Warmline and the services they offer there.
Thank you, Claire. Hello. The New Mexico peer-to-peer Warmline is a line that individuals can reach out to talk to a peer who has similar lived experience, is available to listen, and who offers support. It was started in 2015 and is one of the few fully state-funded peer-staffed Warmlines in the country. The New Mexico peer-to-peer Warmline works side by side with the New Mexico Crisis and Access Line. People call the Warmline for various reasons. Some call when they feel hopeless, worthless, sad, or anxious. We are here to hear you. People reach out when they are experiencing challenges regarding emotional, behavioral, or mental health. We also support callers regarding substance use or addiction. Peer support specialists are glad to talk about recovery and resiliency strategies. We provide information about ways to support youth who are experiencing mental, behavioral, social, and emotional concerns. We also have certified family peer support specialists and licensed foster parents who can provide support regarding the challenges of being a parent or a foster parent. The peer support specialist on the Warmline can provide information about community services for mental health, behavioral health, or substance use treatment. We provide a safe space for someone to share their experiences, and we offer hope that recovery is possible. We are available to support community members through voice conversations as well as text messages. We focus on empowering and encouraging callers to implement the strategies discussed that will help the callers achieve the goals that they have set for their life. The hours for the New Mexico peer-to-peer Warmline is from 7 in the morning to 11:30 at night for voice conversation. And we provide support through text messaging from 6 p.m. to 11 p.m. at night. 7 days a week, the Warmline is open, and the number is 855-4NM-7100. And back to you, Claire.
Yeah, so that's kind of an overview, a little bit of information about us. We're going to pass to the 911 center now, and then we can certainly be here to answer questions after. And also if there's some questions you have to put in the chat, we can respond there as well.
Great. Thank you very much, both of you. And yeah, we'll have a Q&A session after 911 goes. So feel free to put your question in the chat, or wait until we have the Q&A and you can raise your little yellow hand down at the bottom where it says raise hand, and you can ask your question verbally as well. So with that, I'll hand it over to Marshall Dean. Marshall is with the Santa Fe Regional Emergency Communications Center. He's here with Roberto Lujan, who is the director of that RECC center, as we call it. And so take it away, Marshall.
Hello, welcome everybody. Thank you for having us. One of the things that we'd like to express is the way that 988 was converged and how it uses the area code. When Santa Fe is known for its historics and its scenery, and it's, you know, a tourist location, and a lot of people come to Santa Fe and retire here. And a lot of people, where they come from, they keep their telephone numbers on their cell phones from all across the country. So that can be a challenge when it's going into the system, because it's going to recognize the area code of that cell phone, even though the person now resides here in Santa Fe, New Mexico. It's gonna send them back to Virginia, Texas, California, wherever. So those are some of the challenges just up front with that. We definitely have had our share. We've been dealing with the 988 resources and you know, implementation of our staff in training them to where they're triaging these calls and identifying that, you know, the person is nonviolent, there's no history of violence, they don't have access for weapons or to weapons, and that there's no need for immediate medical attention. We do have a mobile crisis unit that does, we refer them to when those criteria are made, where there's no harm to any other party. So we started rolling that out and training our staff. We also utilize a program through Priority Dispatch that has two different protocols, one for a first party caller and one for a second party caller, that identifies some of these things where, you know, a person that is involved, you know, is not violent, and, you know, refers us down to where we can transfer it over to a 988 so they can get in touch with the counselor, you know, the resources that are available to them on that side. So, you know, we've been doing that since the rollout of 988 here in Santa Fe, and, you know, put it out to the staff and are training them on that. One of the interesting things that I did come across were when it came to knowledge of what 988 is currently we have a group of internships from the high school, and several of them are in college that were here last year. And I asked them, you know, in the past couple of weeks if they knew what 988 was, and none of them knew. Some of them, one of them said he saw it on a billboard but didn't, you know, pay attention to it. So educating them at a younger, earlier age, because we are seeing an increase. We have seen an increase of, you know, suicide attempts, and whether unsuccessful or successful in the younger generation. So that was kind of interesting to me when I asked him, you know, recently, do you know what 988 is? And neither of them, and I have 8 of them that I asked out in the front. So, you know, I think educating them earlier on that part, you know, what the services are for, how they're available, what's offered to them, you know, on the across, you know, anywhere, if they're on vacation anywhere, to be able to reach out should they be feeling depressed or have any of those, you know, thoughts or idolations where they either want to self-harm or, you know, do anything, commit an act like that. So that was just, you know, with the internship. Now, taking that same approach with educating our floor staff that are getting these calls, looking for these characteristics in these calls, you know, are they, when they're getting that information from the caller, what's being said, how is it being said, what's the background noise like, and also just, you know, the state of mind, is there a history there, you know, how many times has, you know, they gone out to the property, and getting all these facts out to determine, because we all know that some of these, you know, statistics show that 1 in 5 of these turn, where there's police involvement turn into something worse, where you have a use of force concern or issue like that. So we definitely have, been training internally on what we do here and with the programs that we have. But I think just being in touch with you all to be able to be more cohesive between the two 911 and 988, where we're able to identify any of these gaps or any of these things where we can, collaborate and see what's going to work, in the best interest of everybody involved moving forward. That way we make sure we're, doing things right.
Yeah, and to add to that, we do not transfer calls to 988. So if a caller is in crisis and calling us, we will create a call for service in our local system, and the responders will review that call. The city of Santa Fe has the alternative response unit, and the majority of the time when the caller is in crisis, non-violent, and not requesting an ambulance, the alternative response unit will respond to those calls if they are on duty and provide assistance that doesn't involve law enforcement. So we do receive calls from 988, but we do not transfer calls to 988 because we are not licensed therapists or counselors, and we don't want that liability to transfer someone that's in a crisis that could turn into something that could be potentially violent or put other people in danger. So what we do is we enter the call and let the professional responders determine the response, and they will respond in person and refer subjects to resources as needed. And Marshall, did you want to share your presentation?
Yeah, let me pull it up here and share it real quick.
Oops, I think you're muted now, Marshall.
Okay, can you guys see it there?
Yes, we can. Thank you.
Can you guys see my screen there? Because I'm working on two separate ones.
Yeah, we can see it.
So this
We can see it, Marshall.
this is what we had come up with, internally, why, 988 was to help, people experiencing those suicidal or substance abuse or other mental health crises that do call 911 for seeking out, help. When, obviously 911 isn't the right resource for that. And somebody needs, to talk to somebody, there really wasn't anything in place. And, that's where law enforcement showed up, and that was like the wrong person to show up to these particular cases that, so having it, accessible to people, and then obviously the continuum of care. So the current part was, obviously 988 is an easy number to remember. And that's one of the things why I was, surprised that, some of the high school kids and the two that I currently have that are in college didn't know what it was. They've seen the billboard, and one of them mentioned they saw posters somewhere, but they didn't have like direct knowledge. And, and I felt that was important to kind of start teaching them, what that's for, should they ever need it. Also, it opens up a network of crisis centers, including, for veterans, local centers, and everything within, Santa Fe and Santa Fe County. So some of the statistics that I did pull up, was, the 9.6 million calls since the launch. And that came through 988 Lifeline Performance Matrix, where those numbers were. Some of them, as we go on, weren't updated. So some of the future goals that I see is to capture 90% of the calls, that are received. And what that does also too is it does help some of the call volume within the 911 center to address, other emerging situations. Also does take from having somebody who's, experiencing something like that where they transport him, they have nothing, they don't know what to do with them, so they take him to the hospital. So now the hospitals have an uptake, in their intake systems as well. So, it's definitely working, and that's one of the things that I see as a future goal, and a long-term vision is coordination between 988 and 911, so that people that are in crisis get the most appropriate care when it's needed. And those are some of the things that we are striving for and have put out when we're dealing with these calls. Some of the so in this is what I pulled from the SHASMA and the core principles and stuff, and that was what I was telling the interns was to it's a safe place to be, and it's somebody to talk to. And one of the first things that when I said, well, what if I don't want to give my name? I said, you don't have to. It's one of those things that protects them when it comes to that, where they don't want to divulge any information or date of birth or anything like that we would normally get on the 911 side. It's different than the 988 side when they're experiencing some of these difficulties, and they were pretty interested. So they got that, which would be the ideal response system. The legislation timeline that I mentioned earlier before we kicked off, this is what I had put together after everything that I pulled from it being proposed in Congress, from FCC all the way up to currently where we're at, and the official transition from the 10-digit to 988 for all the public safety answering points in the state. Some of the players, obviously we have our federal government through legislation, the implementation of them, the leadership, grant allocations, for you all that supports these programs, oversight, public policy, communications, administration. There's plenty of other. Some of the legislative numbers that I did receive also that I pulled from here was here. Identifying New Mexico does not have an advisory board that covers a lot of these things. So these are some of the things that we're looking at it to enhance our implementation, and also concurring with 988 here for the people that we serve here in Santa Fe and Santa Fe County. These are some of the mapping systems that are there of partial information of 988, with Maine being identified there. Some of the House bills, as you can see, New Mexico enacted in 2022 House Bill 2, and then in 2023 House Bill 505, that outlines basically the funding that was provided first in 22 and 23. It is separate from 911 when it comes to the funding, because there is a 911 fee. I'm sorry, but the sun's coming in through the blind there and it's shining on me. But that's, so some of those things are, when it comes to like cell phone surcharges and, grants. So, funding is obviously could be a concern when it comes to educating the public as well as people in the public safety, arena. Contacting them, average call time, it was identified earlier, I think she said 18 minutes. So it's, averaging 15 to 20. Staffed by master level crisis counselors held to specific national standards, which is a good thing. And, a lot of times, we get the people that call here and, they just, they want somebody to talk to. So having that, active listening going on and listen to their concerns or what they're reporting, is vital. And then after, refer to callers, outpatient treatment, set up follow-up calls. And, that's, we feel is important, because when we get off the phone with them, there's still another avenue out there, putting them in contact with the right people, with the right resources for the right reasons. And that's, one of the things that, educating on that part when, 988 and the difference between that and 911. Obviously, with the calls and texts, some of the advancements in technology are definitely coming into play. But again, location is going to be key, especially when you have somebody that's experiencing something or making these threats, and they're in a area that's not associated with an address or a physical address. How do you locate them? What if they're in the mountain somewhere and they don't know the highway number, the street number, there's no house there? What if they're on the trail? They don't know what the trail name is. So, some of those advancements when they're talking, I think that's part of what was mentioned earlier when APCO and NINA both reached out and, got together, at the national level and said, that was an issue. And being able to locate and have the technology on the 988 side that's similar to what 911 has is important for you guys as well, because it does use the technology that's in smartphones these days. And that's also important when you're trying to find a location. So as of 2024, there's been over 10 million calls. There was no current update. That's some of the statistics that I did receive. Again, here's the states that are there. As you can see, where New Mexico's falling 80 to 89%, which is, within the 23 states. Here's all that information, and I can share this with anybody here if you guys, want it. I can definitely share it and, just send it over. That way you have, what we have. The partograms, shared goals, obviously anonymity. I think that's where talking with one of the college students was, concerned about leaving his name and personal information and explaining that to him. I think that's important, for anybody to know, especially when, they want to call, anonymous and, they're just having a bad day, or they're serious about, doing something that, they're having second thoughts on. Obviously, the program shared goals, I think we can share together is, help people that are in those emergencies, save lives, and, get the right people in, in place and, at the right time. That's important. And also, like I said, some of the delays in that, like I said, early on when we were dealing with some of the calls that were getting transferred to Florida, and then if they're calling from a different phone, like I said, I had a different area code. I mean, that call could, be on idle. Hopefully somebody was talking to them, but there was a big delay. And not just here, when I talk to other centers at these conferences that are experienced some of these, influx of calls or none, wondering what was leading to that. And that was what was identified. So some of those barriers, obviously the lack of information, the patient is not in the PSAP. So PSAP is the public safety answering point, and that's what we are. We're a PSAP here in Santa Fe. And the boundaries, the jurisdictional boundaries, that's important too, because if you're right on the borderline, are you going to be in Albuquerque, Sandoval County, Bernalillo County, Rio Arriba County, San Miguel County, Torrance County? I mean, there's just so many different boundaries within that surround Santa Fe. So being able to identify that as well is important. One of the things that Texas did change in their advancements to, updating their 988 systems there was answering the phone. So they're asking them, do you need help from police, fire, and EMS or mental health? So that's one of the things that Texas just, started utilizing as of April. Not all of them, not all the PSAPs in Texas are using them, but some of the bigger metropolitan areas are that had a bigger call volume or are doing that. So, that's one of those interactions. The benefits to the community, obviously, like I said, it reduces the load on the 911 system. That's going on. The other calls allows responders to focus on other incidents and reduces the load on the ER because, at that point, if they admit them, they admit them. If not, they put them back out and then, something else happens. So, there's a lot of benefits not only to the 911 industry, but also the public. And also for the public, the coordinated crisis response, where, each entity has the same training and identify the caller's needs, and they get the appropriate, services that they need, and putting them in, contact, and then the follow up on that side too, which once we disconnect the call, we don't have that. When they go on and we have, ARU or our mobile crisis team go out, the phone rings again, we're on to the next 911 call, the next emergency. So, having them follow up and those contacts made where they're able to call back, to that person and, touch base a day, 2 later. I mean, that's important as well. Again, like I said, develop the policies, here in Santa Fe since the rollout, I think in the state, I've talked to people in Valencia County, Rio Arriba County, San Miguel County, one in Red River. Red River was actually asking us to see what we had in place. So, to deal with 988. So, I think we can, work together and, get a streamline going on and to, have the best practices, for the community that we do serve. And it starts like with what we're having. Thank you, Mr. O'Hare, for, having us here, but, meetings, any in-service trainings, joint trainings, tabletop exercises, and visits, seeing, what the 911 side is on this side, and, us being able to have our staff see, how you guys deal with it, is important. That way they have a better understanding as well. And then there's the QR code, which has all this information in there. If you want to get that, or I could just send this to everybody that's here, or I could send it to the administrator and you guys can disperse it as you would like. And then the fact sheets for New Mexico, and that was pretty interesting. Like I said, this is what NEMI has reported, and this is the last that, when it comes to the current stats, this is the most current one that I was able to, pull. And it has everything in it, especially this, when you have incarceration, involved with there. So, that big number there, 536 lives, lost to suicide. I mean, that's it's pretty high. And we see it, we see it quite frequently, unfortunately. Then I'll go back to you guys.
Great. Thank you so much, Marshall, for an excellent presentation. We've now entered the question and answer portion of this session. So again, feel free to ask questions in the chat or raise your hand down below where it says raise hand. I think it says that somewhere. Maybe it's under more. Just for clarity, Marshall addressed this. I just wanted to clarify it or reiterate it. Marshall, you had mentioned that all 988 call responders, the staff that are answering the phones, they have a master's level, basically, degree in counseling. Is that what you said?
No, so that's what Nina and APCO are looking at to see what level of expertise they have on that, because 911 personnel, we're not. We do have a medical license to triage medical calls, but we're not a physician. We're not a doctor. We can't diagnose people on the phone. So, putting them in care with somebody who can deal with those, conditions, as priority. So they're just looking at that to see how that would bridge the gap for 911 personnel and trained professionals. But New Mexico doesn't have anything.
Okay, so maybe my question is then for Claire or Nanette, for the call responders that are answering 988 or the New Mexico crisis line or the Warmline, what training or certification do those call responders what training are they required to have?
Yeah, so we do have answering the NMCAL and 988 phone numbers. We do have a lot of master's level clinicians, and then we also have bachelor's level staff who are, have over 2 years of experience in the mental health or behavioral health field, and they work closely with the master's level clinicians. So we have, different sets of oversight and things like that we do. But our staff are really well trained. We actually have, Brenda, what is it now? Is it eight-week training program? It's about 8 weeks. It kind of depends a little bit on the person, but we do have our own internal training program that's really extensive.
And I will say that there are national standards for training for any counselor who answers 988. And so, of course, we also have our staff complete all of those trainings, plus our own training that we've developed over time. Yeah. Nanette,
I was just going to say all of the folks answering the peer line are certified peers. It's a New Mexico certification within our state.
Mm-hmm.
But I don't know, Nanette, do you want to speak to what those certifications typically are?
I would just say that that it is the certifications, but we also do ongoing training and on the CE requirements and things like that.
Thank you. I don't see any. Oh, there is a question by Patricia. Patsy.
Good evening. Great presentations, Greg and Jessica. Thank you for bringing these folks together. My question is, how much supervision do the peer support specialists get? And do they have immediate access to a master's level licensed clinician if something comes up that, they're not able to to handle. Claire, can you expand on that? Would
Yeah, so we do have different levels of supervision support. So there is a Warmline supervisor that's on, running the shift. So the peer support specialists actually have a supervisor to reach out to. And then additionally, we work really closely together, NMCAL and the Warmline. We're one and the same in a lot of ways. And so they're able to actually we transfer people back and forth. Sometimes we identify this person would be better served on the warm line. And sometimes they identify that someone might, there might be some kind of risk that needs to be explored more. And so they are, the folks on the warm line are able to transfer them to our counselors on the NMCAL side.
Great, thank you. I see Jonathan's hand up. Jonathan.
Yes, thank you, Craig, and thank you, everyone. This is a really superb presentation, and it answers a lot of things that everybody in our community wanted to know about 988, so thank you. My question has to do with follow-up and transition, and being able to hand off the caller to somebody who needs ongoing care, and how would that look, and if there's any follow-up from 988?
Yeah, so we have a couple of different things. One of them is going to be very specific to New Mexico. So we actually have access to a platform called Open Beds. I don't know if you've all heard of it, but there's providers in the state are able to set up accounts. And so essentially what we can do is we can put in our search criteria based on what they're needing, and we're able to actually submit a referral on their behalf to Open Beds. And the goal with this is that then those providers are able to reach back out to that person to get them enrolled in services. There's a time limit. I'm not sure, Tanya, you might have to answer this. I don't know if it's a day or two, but we give the providers a bit of time to respond back to the person. If we see that they haven't responded to them, then one of our peer support specialists on the warm line will reach out and kind of assess, do we need, it's 3 days. So we give them 3 days, and then we'll assess if we want to do a different referral or find another way about that. The other option that we have is that we will, on any call where there is risk of suicide, we're actually able to make a plan to call that person back. We usually try to do it in the next day or two, just to kind of keep things fresh, but we're able to essentially provide them resources and then call them back to say, were you able to follow up? How did that go? Do you need anything else from us?
Thank you for that, Claire. I see our board president, Betty Shover's hand up. You're muted, Betty.
Okay, sorry. You hear me now?
Yes.
Thank you to our presenters for taking the time this evening to share this information with us. I know most of you, this is probably overtime, and so we appreciate your time tonight. I wanted to share with you a little bit of what I learned at the NAMI convention last month about 988. Apparently there's a 988 Local Response Act, and maybe Jackie or Patsy know about this particular act, since I know you guys have been involved with 988 pretty intimately, since NAMI has been very involved with 988. But one of the things, and I think Marshall was talking about how the calls would be taken, not based on your area code, not on your physical place. So one of the things that I learned was that the 988 Local Response Act was going to direct the FCC to require carriers to route calls based on the proximity of the caller to the call center and not the area code. I mean, just I guess like you guys are doing it, getting it via 911. I guess that's a goal to have that for 988. Also, this act is going to specify that a caller specific location details not be available, and I don't really understand that. I would think you would want the location details to be available, but that was another thing that came out of this talk. And this act also requires carriers to allow calls and text to 988, even if their phone plan is inactive. That's another goal. And they're also going to require multi-line systems like hotel and office phones to support direct dialing of 988. So maybe we have all of that coming. I don't know, but and I don't really know where we are on the act, but it's all good.
Great. Thank you for that, Betty. Let's see, I'm not seeing any other questions.
I have a question.
Oh, I'm sorry.
No, that's okay.
Oh, sorry, go ahead.
Go ahead, Corinne.
Okay, my question is this, is 988 being used in every state in the country?
Yes.
Yes.
Okay, all right, good, good. I'm glad to hear that. And thank you all very much for all this very valuable information.
And I see a question from Jackie, one of our board members in the chat. The question is, are call responders expected to complete their interventions, their assistance in a set period of time? If so, is pressure exerted on the counselors to complete or wrap up calls quickly, or is the time needed driven by the caller?
I can respond to that. I wrote a version of the response in the chat. What we're trying to ensure that we do is stay in context of the role of the service. And in particular, we don't want to get into the territory where we're doing what a therapist would do one-on-one with someone. So sometimes there are boundaries that need to be set, or just education on what the service is about. And sometimes callers have a different expectation than what the service is. So we try to navigate that carefully, but there's not a set time limit.
Great, thank you. Let's see, I'm going to call on Davina. We haven't heard from her before. Davina, go ahead and ask your question, please.
Hi, good evening. So I'm Davina Nez, and I cover like the tribal communities. So myself going out into the rural communities, I've been getting questions about 988. How does this work? And then also, are there any type of services, say like if there's a language barrier, do you guys provide the translation services? Because I know in some communities, they still speak their native language. So in my language, I taught Navajo. So even for me to translate it to my elderly mother, it's still a little difficult. So I'm just wondering, like, how do you guys provide that services for like our indigenous communities?
Yeah, so what we have right now is we partner with like an interpreter service that we're able to three-way call them to connect them on the phone, so we're all three together and communicate that way.
Awesome, thank you.
I'll add to that 988 nationally, there are a couple of prompts that people can get to, and a Spanish line is one of those options. At this point, it's only English and Spanish, but and then there's a couple of other prompt lines such as LGBTQ+ individuals and veterans.
Thank you for that. Patsy, we'll go back to you. I see you have another question.
Yeah, great, thank you. And I'm sorry I have so many questions.
It's okay.
Great presentation. So just two questions. First, I was curious about this open beds issue. Is open beds a contract with a specific provider? Is it a multiple providers that are part of open beds? Because one of the issues we face in NAMI, Craig, everybody can respond to this. We get a lot of calls for people who don't get the follow-up after being in crisis. Where do we go? How can we get another appointment? We need that follow-up so that we will no longer be in crisis. And so I was curious about the open beds contract. Who is it, especially in our community? or is there an agency called Open Beds? If you could clarify that for me, I would appreciate it.
Yeah, so the Open Beds is really more of, I think, the technology platform
Okay,
that we're
okay.
using. So it's provided to us by the state, and essentially mental health providers. I think some of the mental health providers, depending on what funding they get, are required to use Open Beds, and then
Okay.
additionally others can volunteer. So we like the core service agencies are definitely on there, but there's also like, outpatient clinics and rehab facilities. So essentially it's just like a database for us to use and to be able to send referrals. And there's lots of different providers in there.
So then the providers would get a notice that someone is in need and they could contact that individual to get them in for continued services. Claire, do I understand that correctly?
Yeah, so we
Okay.
we do need consent in order to send a referral. So we're going to make sure that the person is fully okay with us providing, their information
Okay.
to someone else and getting that phone call. But if we do have consent, then yeah, we're able to send like a name, phone number, a couple of demographic pieces. We can type a little note as to kind of what they're looking for. And then the provider can reach back out to them.
You get them. Well, I think that's great. And then my last question, and it's a quick one. We do a lot of advocacy at the legislative level. We don't call ourselves lobbyists, but we're mental health advocates for NAMI. But how is the funding for the 988 working? Do you have enough resources to continue a sustainable program? How are you doing in that arena, and how can NAMI help to support you in that continued work?
Yeah, so right now our funding kind of along with the rest of the state funding gets approved. I think it's every 2 years. So we're going from like 2-year chunk to 2-year chunk. I know recently there's been some conversation with the Behavioral Health Services Division around finding some more like a set funding source from 988. So what some other states have done is that they've added a tax onto cell phones or phones systems, and that actually pays like for the ongoing funding for 988. So I think that's kind of the next conversation that we're having is like, is there a way that we can work in the funding for 988 to be something that is sort of just automatic and that we're not having to reapprove every 2 years.
Thank you for that, Claire. Marshall, it looked like you wanted to weigh in on something. Feel free.
Yes, just a question or suggestion. But my first question is, in that funding and those of you guys, with 988 on not only the state level, but the national level, something to consider. But if we have a domestic violence incident where, whether it be a male or female that's displaced with their children and they leave home with nothing other than the clothes on their back and they go to a shelter, they give them, a lot of times a cell phone to call 911 in the event of an emergency. Even though the phone is not connected or anything, I mean, those are those are federal laws where a dead phone can call 911. Even if it hasn't been connected in 5 years, if you have an old phone and it works and it holds a charge, you can call 911 from it. It's just that 911 can't call them back. So for the 988 folks, that'd be something to start discussing, because somebody might have a dead phone and they won't be able to reach. It's not a 911 thing. I mean, they'll be able to call us, but having to put you guys in contact with them might be a little tricky, because we can't call them back, or the phone dies or something. Not just suggestion, or open up some ideas.
Great. Sounds like good ideas. Let's see. I've got a question. It probably is for Claire, might be for Nanette, but In the spirit of continuous improvement, I was wondering if you regularly or at least periodically do a survey of the people who've basically had a 988 or crisis or Warmline call to find out the degree to which they're satisfied with the assistance they received.
Yeah, we do have the option to send a survey. So again, just because we are mental health providers, we have to be really careful about receiving consent to send any like text messages or anything because then people would know that you could potentially know that you contacted us. So we are able to offer surveys in the situations where, you know, it's not going to like inhibit them getting care from something else. Like if we're getting them connected to like a mobile crisis, it can be kind of clunky and we want to make sure that they are fully connected with that service. So yes, we do offer it. And if they consent to it, we're able to send it out to them. Yeah.
Great. Thank you. We're just about getting close to needing to wrap up, but again, if you have another burning question to ask, feel free to raise your hand or put it in the chat. I just wanted for clarity, Claire, you mentioned this and just I wanted to be clear on this. My question was originally, when should someone call 988 versus when should they call the crisis action line or the Warmline? But I believe you said that basically it doesn't matter which one of those three lines they call. It's going to be handled in the same way with the same staff. And it doesn't really matter whether they're using the 10-digit crisis line or 988 or the 10-digit Warmline. Is that correct?
So the 988 and the NMCAL 10-digit phone number would go to the same people, the same staff. The Warmline does have a separate set of staff just because the needs on that line are a little bit differently and they're more equipped to handle, to manage, you know, those calls. So the Warmline's kind of focused more on just like general support, you know, being able to share some lived experiences, being able to offer resources and ideas. Hopefully I got that right, Nanette. Let me know if I missed something. Whereas the NMCAL and 988 is staffed with mental health counselors who are going to be able to intervene and support through any like mental health crisis and be able to give, you know, some education and resources for continued mental health support.
Okay. Now, if I call 988, but I'm not in crisis, I'm just struggling with like an addiction I have, or, you know, I'm dealing with mild depression or whatever, will the 988 call then get bumped over to the Warmline, or does it depend, or how does that work?
We're always going to try to assess folks who call in because we trust that they reached out to us for a reason. Oftentimes, as you begin to have a conversation about what someone's going through, you might discover things that, you know, weren't initially at the top of the surface. Like maybe there are some underlying thoughts of suicide. So we are gonna, you know, have a little bit of a conversation with them. If at a certain point in the call we've you know done some assessing and we're thinking, you know, this would really be someone who could benefit from the Warmline, we're going to refer them over, and the Warmline does the same for us. So yeah, so in a way you can't reach the wrong line because we can help you get there.
Great. That's great to hear. I'm not seeing any other questions, and we do try to wrap this up roughly around 7. I'd like to thank, on behalf of NAMI Santa Fe and the board, the whole New Mexico Cal team that's here tonight, Claire, Tanya, Brenda, and Nanette, and also the Regional Emergency Communications Center staff here, Marshall and Roberto. And thank you not only for being here tonight and sharing your wisdom about your programs, but just thank you for what you do on a daily basis for the citizens of our community when they're struggling with these various behavioral health issues. You are clearly the front line of dealing with people who are really struggling, be it a crisis or something somewhat less than a crisis that's still can be very debilitating. And a lot of times I believe you're probably the first call somebody makes on their behalf or on behalf of a loved one that are struggling maybe for the first time with a substance use disorder or a mental illness. And so you do seriously important work for our community, and just wanted to thank you for that.